Hello, everyone. Welcome to a very stormy evening in Israel. It's even snowing in Jerusalem tonight, which is always considered a huge cause for celebration. As a result of the storm, we've all been having power outages. So if one of us suddenly disappears, don't worry, we will be back on our phones as soon as we can. So I'm Nikki Blackburn. I'm the editor of Israel 21C, a non-profit organization sharing news about Israel with the world. And today we're going to talk about what is probably one of the most pressing issues on everyone's minds right now, the COVID vaccine. As most people know, Israel has been the leading country in the world in terms of vaccinating the population per capita. In many ways, we are viewed as the bellwether of what the post-pandemic world is going to look like. Our vaccination program began on January the 16th, and already 90% of the population over 60 has been vaccinated. And altogether, we've vaccinated about 44% of the overall population. So what have we discovered in this time? And what does it all mean? And the biggest question of all probably is, are we going to go back to normal anytime soon? We're going to talk to two experts in the field and find out more. So I'm delighted to be able to introduce you to Dr. Ronald Ellis. Dr. Ellis has almost 40 years of experience in vaccines, immunotherapeutics, and biological products. He was the project leader for 6 successful vaccines for diseases including chickenpox, rotavirus, and hepatitis B. He currently works as a consultant on Israel's COVID vaccine program. We also have Dr. Ella Sklar. Dr. Sklar is a virologist studying viral host interactions of RNA viruses at Tel Aviv University. She was recently involved in identifying the mode of action of several antiviral host genes, protecting from dengue and Zika virus infection. So thank you both for joining us today. Thank you very much. Just before we start, I want to remind viewers that we will have time at the end for questions. So you can write in either on the chat button or Zoom. And if we don't get to your question, don't despair, because Ron and Ella have kindly offered to answer as many as they can after the event. So please, if you have a question, send it to us at info@israel21c.org, and we're going to send you the email address later. And we will publish the answers on our site sometime next week. So Ron and Ella, what do we know so far? From what you can see in Israel, is the vaccine working? Ella, do you want to start?
Yes, I can start. So, I mean, people think this vaccine is like magic, but the truth is it takes some time. And the first people that have been vaccinated were the people over 60. It takes about 3 weeks between the 2 doses of the vaccine. And after that, you also need to wait for about 2 weeks for the antibodies to fully develop and the protection to fully develop. So we're just now starting to see a significant drop in the cases over 60, which indicates that the vaccine really works.
Okay. I mean, what are we starting to see as a result of this? I mean, I know that the R number is falling, the new cases are falling, and you know, there have been a decrease in serious cases in the age 60 and up, but we're seeing more young people under the age of 40 getting it. So, I mean, what other things are we actually seeing? Ron, do you want to take a look? Give us an answer.
Yes, part of the dynamic is that people of lower age groups are much lower. A much lower percent of them are being vaccinated so far. In addition, I think some of the younger people are paying less attention to things such as personal hygiene, social distancing, and wearing masks. And as a result, they're continuing to get infections and becoming a larger proportion of the overall infected pool. I think the next step is going to be that more and more younger people get vaccinated, and as more and more do, the overall numbers will drop, the number of severe cases will drop, and we'll see much more of an indication that it is working for the entire population. But it is going to take time. Young people perceive that they are less threatened by the disease because they don't get, as on the average, as severe cases as the elderly. Nevertheless, we've seen, unfortunately, younger people get very sick and some die as well. So it's going to take continual education, continual prodding to get vaccinated, and in addition, keeping up everyone's guard with masks, social distancing, and washing hands until the level of virus becomes at a much lower level in the entire population.
Mm. I mean, there have been several studies that have been published recently looking at the data, the Pfizer data, the data of the Pfizer vaccine. And they showed that it does reduce the viral load and it does reduce transmission. Is this something that you have seen, that you are, that you have some reaction to? Either one of you, please.
You just ask one of us and then it will be easier. So.
All right.
Okay. You want to start, Juan? I can.
Sure. It's true that the virus does reduce the level of, that the vaccine does reduce the level of virus. But I think it's important to keep in mind that vaccination does not prevent infection. It's hopefully preventing disease, serious disease, and death. In fact, it's only a very small minority of vaccines overall. And I'm looking beyond COVID to flu, measles, mumps, rubella, varicella, all the typical vaccines. Most of them do not completely prevent infection, but they prevent disease. And so it is here as well. In addition, the immunity from the vaccine will get into the nasal cavity to only a small extent, and eventually then gets into the lung to an extent, and that prevents the disease. But the extent to which the immunity gets into those areas starts to reduce the amount of virus. And all other things being equal, the less virus the person has, the less likely it is to be transmitted to somebody else. So even the reduction of virus, not the elimination, just the reduction itself has this additional positive effect of reducing the probability of transmission to somebody else. Or if they transmit to somebody else, they're transmitting a much lower level of virus. And all other things being equal, the less virus you're infected with, the more likely you are to have a mild case. So all those things are working in favor of the population having less of a disease burden.
And,
right.
and it's another reason to keep on wearing your masks and keeping social distancing, because even if you had been vaccinated, you still can infect someone who wasn't.
Right. I saw a study just recently that also showed, an Israeli study that showed that even one dose of the vaccine lowers the viral spread. And of course, this is quite a topical question, because in Britain they are only giving one vaccine at the moment. They're not giving you the second dose. They said that it will be 12 weeks difference between the doses, but as far as I can see, I'm not sure that many people are getting the second dose. So Ella, what do you think about this?
So in the UK, they have a different situation now. They have a lot of patients and a lot of sick people, and they really have to think about what to do to stop that as quick as possible. They're also giving a different kind of a vaccine, the Oxford AstraZeneca vaccine, which has a different efficiency level than the vaccine, the Pfizer vaccine that we're getting here in Israel. So, I mean, there is some evidence that after some dose, you have some protection. The 12-week period, I think AstraZeneca just did a trial that showed efficiency also after 12 weeks, but it's on a small amount of the population. But when you have the disease roaming all over England, you have to stop it somehow, and that's the solution they found. And that's what they have to deal with. And you know, we're in a completely different situation here. And we can afford giving the whole population the 2 doses. And we know that 2 doses give better protection for a longer amount of time. And there's no reason for us not to do that.
Right. Can I ask, both of you, have you had your vaccines? You've had the double dose? Ron?
Yes, I have. My wife, our children, their spouses, all of us have received 2 doses, and we hopefully making lots of antibodies against the virus.
And you, Ella?
I did.
You did.
First chance I had. When they opened it for my age group, I was there.
Right, because I've also had it. My husband's had it. One of my children has had it. But there's a lot of people who are very fearful about getting the vaccine, and there's a lot of disinformation. And I know we talked about this before we came on as well. What are the main stories that that you're coming across, and you know, what would be your response to them? Ella, do you want to start us on this?
Sure, I can start. So I get a lot the fertility question, that the vaccine affects women fertility. So first thing I can say about that is there were some papers saying that the disease affects male fertility. So maybe it's a good idea that first males will get vaccinated. But I think the rumor that it affects women fertility is a complete rumor. There is somebody raised the rumor that there is a very small homology between the viral protein and a protein which is in the placenta, and that causes antibodies raises antibodies against the placenta. And this is completely not true. I mean, there is some very, very small homology that is not even immunogenic. And if that was true, then everybody who would have gotten the disease itself, which also expresses that the virus itself, which also expresses that protein, would have been infertile. So that's completely untrue. And there's no reason not to get vaccinated whatsoever. Either if you're a male or a female, the vaccine doesn't affect fertility at all. There's rumors about long-term effect or putting stuff that is not natural into your body. I mean, all of that, I think RNA, I think Ron can talk about it more, but RNA vaccines are among the safest vaccines that we ever had. I mean, after 8 hours, the RNA is not there. And after, I think, almost 24 hours, I don't think even the protein is there. So it's out of your body. About all these people who are concerned about putting stuff into their body. So, I mean, it clears out, it's not even there. So I don't think that, I mean, that's a concern at all. I mean, I can raise a lot more, but I'll let Ron talk a little bit.
Yeah, no, actually, that's interesting, because, you know, you hear that vaccines have things like formaldehyde and various, you know, nasty substances like this in it. So basically, you're saying that it doesn't matter, this will be out of our system within 24 hours.
So, I mean, Ron can answer that better than me, but this
Right.
specific vaccine doesn't have formaldehyde in it. There was one substance in it called PEG, which stabilizes it, but PEG is also in soap and food and a lot of other things. There was a very small amount of people who were allergic to that PEG thing, but it was like, I don't know, very few cases in millions. And that substance is also in food and soap and many other things. So I don't think that's an issue, but I think Ron is the real vaccine expert here. So
Ron, let's take you on and hear from you.
Yeah, you know, picking up on that point, one could look at vaccines in general, and there can be minor chemical constituents, but in all cases, they have to abide by government regulations that they are below certain levels, and so they cannot cause any harm because these are levels that are validated to be safe. So there's no doubt about that kind of safety issue. As Ellis said, you know, the issues of long-term safety could be on people's minds, saying we haven't tested it long enough. Other vaccines were tested for 10 years. This was tested less than a year. The fear of the unknown. Some people are afraid of needles. Others are anti-vaccine people. There's also people who have this sort of conspiracy theory saying, you know, it's a plot between drug companies and governments to get vaccines out, and they make more profits and politicians get their influence. You can come up with so many different reasons, but I think it's very important to simply focus on the most important thing, which is for any medical intervention, vaccine or otherwise, consider the benefit to risk ratio. The benefit of taking the vaccine versus the risk of taking the vaccine. There's no medical intervention, no drug, nothing that is free, 100% free of any conceivable risk. So when you look at the benefit to risk, it's overwhelmingly in favor of getting vaccination because the benefit is preventing severe hospitalization and death. And the risk is there could be these theoretical unknowns, and they really are unknowns. But for me, the benefit to risk ratio is overwhelmingly in favor. And I think for anyone who has doubt, fall back on the benefit risk ratio, just like you do for any medical procedure or any drug.
Right.
Not only the risk of hospitalization and death, there are, I mean, reports that people have long-term effects after having the disease. So even if you get a mild form of the disease, you can have some not pleasant effects for long-term after that. So
Actually, I
that's
think
also
that we're all getting to the point where we're beginning to know people who have had corona, who had it mildly and then got, you know, terrible symptoms in the wake of that. You know, I think that is emerging more and more, which I hope will help people understand that this is a real disease that we're dealing with. There's a lot of talk about reaching herd immunity, and this has been, you know, everyone's been talking about herd immunity. We didn't even know what herd immunity was, most people, a year ago, and now everybody's talking about herd immunity. But so if enough people vaccinate, can we actually get herd immunity? Ron, do you want to take us away on that?
Well, on the one hand, the answer is yes. On the other hand, we don't really know the exact percent it takes. And for each individual, when they're considering what to do and say, should I take the vaccine or I don't really like vaccines, I'll wait for herd immunity. Please don't wait for herd immunity. We don't know when and if and how it'll be achieved. Take the vaccine first and then think about herd immunity over a cup of coffee with your friend. It's a theoretical issue. The only thing that the virus knows, it's either able to infect you and cause disease or it isn't. It's an individual decision. You can control it by taking the vaccine. And herd immunity it's a difficult issue, particularly with a respiratory pathogen. It's very different from a lot of other viruses, which will cause a disease through the whole body. And the dynamics of what herd immunity means is very different. And that's why you can read experts and they'll quote different percentages. And like I say, it's theoretically interesting, but the real issue is getting vaccinated.
Right. Ella, do you have anything to add to that?
I heard a talk by a vaccine expert in the US that said it depends how you define herd immunity. So, I mean, if herd immunity, I mean, if you define that the whole population will be vaccinated so we can, you know, almost not have the disease transmitted, that will be hard to achieve, especially when we can't vaccinate children yet, which are a large part of the population. But if we are defining herd immunity as getting back to some form of normal life, we can achieve that.
Yeah, I mean, this is the issue. Children make up 25% of the world's population. So until we can actually vaccinate them, you know, we can't reach herd immunity anyway. I mean, this is now a question that is being raised everywhere. When do you think children will be able to vaccinate safely? Ella, do you want to start?
I can start. So I know that Pfizer already finished recruiting children for an experiment 12 to 16. So that the experiment already started. So we hopefully will have the answer within the next couple of months. And all the other companies are also starting also for lower ages. So Anthony Fauci promised until September, I think. So I'll go with his statement because he probably knows more than me.
Ron, have you anything else to say on it?
Well, there are two issues. One is vaccine supply, and the other is clinical trial data. So as Ella is mentioning, vaccines are being tested in younger age groups. There's no reason now to think it would not be good to vaccinate younger kids. Most vaccines, in fact, are used in younger kids. Some of them are used in newborn babies in the first year of life. There's every expectation that the vaccine will be safe in young kids and will work well in young kids, just like every other vaccine. But manufacturers and public health officials are cautious to not recommend something in an age group until there's actual data showing that it's safe and it works well. So it's important to get that data. In addition, if you look at vaccine supply, considering that disease is more severe in the older groups, less so in middle age, and even less so in kids, naturally the vaccine would be prioritized anyway to the older age groups. And as they are saturated and we vaccinate hopefully all of the older middle-aged people, and then vaccine continues to be available, then those get prioritized for young kids. And we'll hit that point, whether it's later this year or next year, but it will happen, and we should assume that the vaccine will be safe and will work well, but we'll get the data in the vaccine just to be sure before we recommend it.
Right. I mean, the thing is, the nature of corona is that it's a pandemic. Which obviously means it affects every country in the world. So even if rich countries manage to vaccinate 100% of their people, can we ever get rid of corona if poorer countries haven't done the same? Ron, would you like to kick us off?
Well, I'd say this, in theory, of course it is possible to eradicate a viral disease. Man achieved that about a little over 40 years ago. Smallpox became the first disease ever to be eradicated from this planet by vaccination, or by any other means for that matter. So it can be done. And in fact, what happened in the later stages of the campaign, it was applied by giving the vaccine in poor, underdeveloped areas. The developed world already had been cleansed of smallpox, but there were pockets in Africa and Asia in particular. But through intense vaccination, it was eradicated. Okay, so theoretically, it's possible to eliminate it. Now, in a practical sense, it's going to be very, very difficult. And I say this because smallpox stands as the only vaccine preventable disease ever to be eradicated. Polio is close, but there are still a few hundred cases a year. The fact that corona is a pathogen of the nose and mouth and lungs, the nasopharynx, so to speak, makes it intrinsically more difficult to eradicate. And we shouldn't wait for it to be eradicated. Once it hits a low enough level, then mankind will be in good shape. And we'll get later to the issue of boosters and how that may be the case. But if disease is driven to a very low level, that's also acceptable. And I think true eradication is extremely difficult.
Especially with a disease that a lot of the patients are non-symptomatic, and that has reservoirs in animals that complicates this eradication thing. That's one point. And then the other point is that there are vaccine initiatives for third world countries that are now in place. I don't know how many doses and when they will get there, but hopefully at some point we can get vaccines also to these countries as well.
Right. So you think that like the richer nations have a duty actually and self-interest to actually help poorer nations vaccinate their citizens? Yes, Ella?
I think there's already some initiatives towards that. I saw a few, the World Health Organization and a few other initiatives sending vaccines towards third world countries. And I think, I mean, when supply will, when we'll have enough supply, I'm sure that all these places will be vaccinated as well.
Right. I mean, one of the things that kind of put a spanner in the works in January when we started vaccinating everyone, and everyone in Israel was like, well, yeah, we're about to be free. And then the mutations started. And of course, this is like a really serious issue. We already have 3 significant ones. I read just yesterday that they discovered another kind of mutation in Britain. And this feels like a race against the clock. So how are we going to win this battle? Ron, do you want to weigh in here?
Well, with some of the mutants, they are either totally susceptible to vaccination or partly resistant. It's not really clear yet if there is one that is completely resistant yet to vaccination. Now, the ones that are partly resistant, it means you need a higher level of antibodies to provide immunity than to the conventional virus. And it might mean that some people who do not make high levels of antibodies will be more susceptible to those particular strains. It is possible that there will be some that are totally resistant to vaccination, but public health officials, basic research laboratories are monitoring the sequences as are manufacturers. And it is likely that in future years, as we get into booster doses, that the composition of the booster will be adapted to the kind of sequences that are available. If there's a particular sequence that has become the dominant sequence and it's somewhat resistant to vaccination, then that'll be the one that starts to get used. And that will be the one that'll go into future boosters. And we've seen that the cycle time is fast. What I mean by cycle time is when you have a sequence, decide you want to manufacture it and get it into people's arms. With many of these vaccines, it goes fairly quickly, particularly RNA vaccines, but even the others as well. So once they're identified, they can be implemented quickly. We see that with flu. Flu vaccine changes every year in composition. The manufacturers change its composition, and then we vaccinate with the new one. And as long as we're mindful of that and vigilant, the disease can be kept under control. And again, that's another reason that eradication proves extremely difficult. It takes just one mutant that can get away a little bit. Future vaccine will take care of it and keep it under control. And it'll be this kind of dynamic that will keep the disease at a low level, but probably not eradicated.
As far as I understood with the flu vaccine, is that even the best flu vaccine was only 60% effective, and that in most flu seasons it's less, because they're trying to match up what they think is going to happen with the vaccine with the flu virus that year, and it doesn't always work out that way. Do you think that's going to be the same issue here with corona? Ron, you're an expert on this, obviously. So what are your thoughts?
It's a bit of a different issue. With flu, in years where there's a perfect match between the vaccine and the virus that's circulating in the field, you'll get up to about 70, 80% efficacy. Protection against flu isn't quite as robust. There are other vaccines. Human papilloma vaccine, for instance, is 100% effective. Hepatitis B is 99. Flu is intrinsically a bit less effective, but we've seen that it's possible to make corona vaccines that are intrinsically highly effective in the range of 95%. So with corona, it's a bit of a different situation. You can achieve this very high level of protection, but again, as we talked about previously, there'll be the need to adapt to a new strain if a new strain starts to emerge, like the British mutation or the South African mutation, and those will be cycled into the vaccine supply to keep things under control. But against that strain, that's perfect match, we should expect a 90+% efficacy. And even if you don't get total efficacy, but the cases are mild or more mild, which we've seen with the vaccine so far, again, that's good. The goal is not and cannot be achieved to totally prevent infection. You want to prevent the serious disease and the death, the hospitalizations. And that's what's being accomplished. So a good match will accomplish that, should accomplish that in the future.
Right.
So I have one comment. So the more we vaccinate, I mean, mutations occur when the virus replicates. And if the virus replicates in less people, because a lot of people are vaccinated and they don't get sick, we'll get less mutants. So the more of the population that we get vaccinated, we get less of a chance of getting new mutants. And that's basically the idea, to go and get as many people as we can vaccinated. And that will also lower the chance of us of getting new variants.
That's a really important point, I think, because people are so worried about the development of mutations. I mean, Ella, when you're looking at this, are you what do you think the chances are that the virus could develop into something that's even deadlier than the British or the South African variant?
So I don't think, so basically from a evolutionary virology point of view, a virus that is more deadly it's not a good idea for a virus to be more deadly. So they don't want to be more deadly. It's a bad thing for a virus. So generally deadlier viruses are not successful. So that's not a thing a virus would want to do. And for the British and South African and Brazilian variants, we still don't have very good evidence that they are more deadly. We know that the British variant is more transmissible. There is some evidence that there is maybe a little bit higher, more death rates, but it's really, really hard during a pandemic to prove all that. So I don't really think they're currently more deadly. And from an evolutionary point of view, viruses don't want to be deadly. And the serious concern is that one of these variants will be resistant or more resistant to the vaccine. And that is also not very likely, because the response to the vaccines is we create a lot of antibodies. And if there is a mutation that changes one site on the protein or 2 sites or 10 sites, we still usually have enough antibody to still provide protection. And we also have other components of our immune system that protect us. So, I mean, it's not a black or white thing. We still, even though some of the variants that we have now lower the efficiency of the vaccines, we're still protected to some extent.
Right. Ron, do you agree with this?
Yeah, you know, we had actually a case like this, 2 cases like this of previous coronaviruses. You know, there are 7 coronaviruses known to infect man. 4 cause the common cold. We have this one, the current one. And there were 2 previous ones, one about 18 years ago, one 9 years ago. Both of those were extremely deadly. One of them had a death rate of about 50% of people who were infected died. The other one was about 20%. But they spread very, very poorly. So there was a big burst, and then it disappeared because it wasn't able to spread well. And that's likely to be the case. Now, on the other hand, we did have a horrible, horrible virus, the worst one of the last few hundred years, which was in 1918, 1919. It was an influenza virus known as the Spanish flu, which was very deadly and did spread well. And that was a very unusual case. And let's hope that's not going to be the case here. But again, because of these 2 coronaviruses, which were very deadly and couldn't spread, that's part of coronavirus biology. That's probably the case, that a deadly one will not be able to spread if one does arise. And it'll be up to us to continue to be vigilant and make sure we do year by year an adaptation to whatever strains we see. And there are enough labs that are involved now in corona research that are monitoring sequences and then testing them in the laboratory, that I think there'll be a very high level of vigilance to make sure we stay one step ahead of the virus.
Right. In Israel, I think, you know, there was a lot of initial disappointment among people who had the vaccine, that they couldn't go back to normal. And in fact, in Israel, things got worse because of the mutations. They shut the airports, and we went into yet another lockdown. Do you think that the vaccine will help us go back to normal? Ella, do you want to?
Yeah, I started the webinar with that I said people think the vaccine is magic, but it takes time for the antibody response to develop. That's why we're seeing now the first effects on the people over 60, which were the first one to get vaccinated, and also in medical personnel. It takes about 2 months from your first shot until you're fully protected. And as you said before, most of the people over 60 are vaccinated now, but not the whole population. We're about, I don't know, 50% with the rest, and still over 16. We can't vaccinate under 16 yet, which is a large part of the population in Israel. We're a relatively young country. So I think that will happen. We'll get back to some form of normal life, but we'll have to be patient. And also, I think there is some effect of seasonality with the coronaviruses. We know that the cold coronaviruses that Ron mentioned before are seasonal. We didn't see that when this coronavirus started to appear because it was a pandemic and most of the population was not vaccinated or didn't have any immunity. But we hope that the summer will have some effect now. So I think hopefully I'm cautiously optimistic, and I hope that with time things will get better and we'll be able to get back to at least some form of normal.
Ron, do you agree?
I do, but things are slowly getting back to normal. The economy is slowly opening up, and particularly now things will be made available to people who can prove they're vaccinated, whether it's health clubs, health clubs, swimming pools, theater, and the like. So it is slowly returning. Restaurants will come back. It's just not happening as quickly as people like, and I understand the frustration. In the meantime, we have to continue to be vigilant. We have to continue to wear masks, keep a distance, wash hands, and hygiene. And if you do that and get vaccinated, you'll be okay. And starting to see older people can now start to see their grandchildren more and get together with others, again, with the proper precautions. As to when we'll be free of masks, that's only speculation. I couldn't predict that, but step by step, we're getting there. And as long as people are patient and vigilant, I think we'll be better off a year from now than we are today.
That's nice and optimistic. That's great. I was interested because obviously in Israel, we're starting to get our vaccine certificates, and they give a 6-month window. It runs out. Mine runs out on July 30th. That's it. So what does that actually mean? I mean, other countries, are they doing the same? Are they saying it's like for 6 months, or, what is the thinking behind this? Ron, do you want to answer that?
Yeah, the thinking is that over a 6-month period, as observations have been made in clinical trials of how long the antibodies last after vaccination, there's a very good expectation that the average population, average person, after 6 months should still be protected. It doesn't mean they're not protective after 12 months, it's just that we don't know yet. Keep in mind, vaccines started to be tested in clinical trials around April, May, June. The oldest cohorts, the oldest groups are now 6 months past vaccination. So you can't say for sure what the levels are after a year until you're a year post-vaccination. Now let's flip ahead to June, July. By then, we may start to get information from manufacturers on people who were vaccinated a year previously, and you can see how well the antibodies have lasted in that group. And based on that, the certificate might be extended then from 6 months to 9 months or 12 months, or there'll be a recommendation for a booster. So it's really to be conservative and not give a date to the certificate that is longer than the estimated timing of how long you are likely to remain protected after vaccination. It's a healthy conservative policy, and I'm sure it'll be updated to either give longer timing or to start to recommend boosters or both.
I think that we lost our moderator, so.
Yeah, maybe you want to go ahead and add to.
Oh,
you're back.
hi. I'm so sorry. There was obviously a power blip then. So yes, thankfully I am back. So sorry, I missed the last. What were you saying?
We were talking about the 6 months window of the certificates, right. And Ron just finished answering, and you can ask the next question now.
Okay, all right. So, Ella, do you think, once a large proportion of the world, or hang on, sorry, once a large proportion of people in each country are vaccinated, will we still end up having lockdowns, or do you think lockdowns are going to be a thing of the past afterwards?
I hope so. I mean, we're learning about this vaccine and about this virus as we go. I mean, we didn't know this virus at all almost a year and a little bit ago. It looks right now, at least in Israel, that the vaccines are efficient. But this virus just keeps on surprising us. I do hope so. If it stays like this, it's likely that we will be able to avoid future lockdowns. There's also a problem in Israel with the last lockdown that people are kind of tired and its effect wasn't as the previous ones. So I'm not sure anymore that this is a good tool to prevent further infection and spread. So we'll have to come up with some new ideas how to do that, even if we need one. So I'm not sure there's going to be another lockdown again.
Right. I mean, what about like Ron? What about closing the airports? Do you think they'll use that as a tool? Because that's another tool they did use to stop this.
Yeah, you know, you can do that in the short run, but you pay the high price. I mean, Israelis travel a lot, and even in the Zoom era, business travel will still remain important to some extent, as well as people wanting to travel. So it's a tool you'd use only if you have to. And again, I think vigilance about things we talked about, vigilance about sequencing and keeping the vaccine up to date, achieving a high level of coverage. If those things are done, then airport closures won't be necessary, lockdowns won't be necessary. Keeping kids out of school won't be necessary. Society pays a very high price by having kids not in school regularly, not just the learning, social interactions. It's a very, very heavy price that that our children are paying now. And that's the reason to avoid lockdowns. And if there's a need, again, pound into people, wear masks, social distance, hygiene. If there's a need to do that ahead of another lockdown. And hopefully that will keep things okay.
Right. So in a way, we've already, because I was going to ask you, you know, can we eradicate corona? And you've already basically said, Ron, I think it was you who was saying that you can't actually eradicate corona. It's here with us. We can only control it. Is that right?
Correct. Yeah, we'll keep it at a very low level. And but I say it's very interesting because, and it's not in the press at all, that the level of flu this year is probably the lowest in recorded history. Last I saw, the Israel had 0 cases of flu. It's very interesting because
there is one now. I know about one at least. So
okay, so I'm going to correct myself and say that it has skyrocketed from 0 to 1. It's gone much, much higher.
Actually, I know someone too, so
it might double from 1 to 2. But what it means, the same things that work for corona, masks, social distancing, and hygiene work for flu. It shows that you can keep a respiratory disease under control and keep it at very low levels. So it is achievable, even if you don't eradicate it. Keeping it under control will enable society to operate normally and enable people to continue to lead, hopefully, healthy lives.
So masks, masks, masks. Ron or Ella, either.
When needed, or better yet, get vaccinated. If enough people get vaccinated, we won't need masks either, hopefully.
Yeah, right. Okay, all right. So look, we've had so many readers' questions, so I'm going to run some of them by you. I also have to let my dog in because she is scratching at the door. Excuse me. Okay, so one question we got sent in, is it safe for people who have allergic reactions or anaphylactic attacks to have the vaccine, and can it cause asthma? Ella, shall I start with you?
Well, I'm not a physician and I cannot give any medical recommendations, but I know that in Israel, if you had an severe allergic reaction before that required hospitalization, you can still get vaccinated, but you have to do it under in a hospital or where a physician is present, and you stay longer after the vaccine, maybe half an hour or something like that, just for medical.
Okay. Sorry. No, she likes to be here in my office with me. Okay, Ron, is the Pfizer vaccine effective against the South African virus strain? I think you mentioned it earlier, but do you think that the success of the mRNA vaccines are going to change the manufacture of vaccines for RNA viruses?
we'll see when manufacturers apply them to other targets. There's a good reason to think it could work for others. Now, whether the one obvious one, for instance, would be influenza. It's not achieve a much higher rate with influenza simply because you can still get mismatch, and influenza's more vaccine resistant than corona. It might be for other kinds of viruses that it will prove to be effective. And even outside the area of infectious diseases, there might be other diseases that are treatable by RNA vaccines. So I think the next few years will be very exciting, and there are companies that are already exploring other targets to see if this technology can be applied successfully for other diseases.
Right. Okay, so somebody asked, I've heard that one should not take Tylenol or ibuprofen after receiving the vaccine. Is that true, and for how long after? Ella?
I think there was one paper in Journal of Virology that did an experiment on mice with NSAIDs, non-steroidal, like ibuprofen. Those inhibit a little bit the immune system, but nobody ever did a serious studies in human. If you can avoid that and take something else that is not a non-steroidal depressant of the immune system a couple of days before and after, that's probably a good idea, but we don't have any definite evidence that that has any effect.
Right. Actually, another question that came in here, and it's very relevant because yesterday there was, I'll explain. The question was, should pregnant women get vaccinated? And yesterday, Ron, you and Ella will probably know already that this story that an Israeli baby who was in the womb died of corona at the age of 25 weeks. So Ron, what do you think about this question about pregnant women getting vaccinated?
It's been a bit of a moving target because there's been different recommendations. I mean, one of the recent recommendations is between about 13 and 32 weeks of pregnancy, that it's good, but not in the very early stage or the late stage. I think the most important thing for a pregnant woman to do is consult with their physician and consult with the public health opinion on vaccination. And I want to refer to the earlier question on allergy as well, that again, somebody has an allergy, it's worth their talking to their healthcare professional as well. And I was thinking about the question a little more. I think it's important to remember that anybody who gets any vaccine, whether it's this vaccine, zoster vaccine, or flu, the instruction is when you get vaccinated, you wait in the physician's office for 15 minutes. If there is going to be an anaphylactic or severe reaction, it will occur within 15 minutes. You should simply bring a book, sit, wait 15 minutes before you leave. And that's, again, a prudent policy for allergy. Again, someone's physician should give that advice as well for somebody who has had a history of allergy. So relying on professional opinion and the public health recommendations, I think, is a good thing to do because they do get updated from time to time as we get more knowledge about high-risk groups and the best vaccination policy to take.
Right. Okay, Ella, in patients who have recovered from a COVID infection, what benefit does the vaccine give?
So I think now, because there was shortage of vaccines, so currently there's no recommendation to vaccinate people who have recovered. But there have been a couple of studies that saw that if you give at least one dose, then you get higher protection, a better immune response. But that's not, I mean, in most of the countries, because there's still not enough vaccines to people who have not had COVID. So generally, I don't think that's recommended at the moment.
Right. Okay. I had a question from the island of Tuvalu in the Pacific. And they were asking, they said the European vaccines are very expensive. Would it be better for us to wait for cheaper medicines that can treat corona or to acquire the vaccines? It's rather a broad question there, but Ron, what do you think about that?
I think the vaccines, because the drugs will be expensive as well. And the vaccines are already proven. The drugs are yet to be proven. I mentioned in terms of supply, and reference back to what we were talking about earlier about eradicating smallpox and polio. There are a couple of hundred cases worldwide or less. So there are donor organizations that give large amounts of money to subsidize vaccines that are given to countries where they have fewer resources or very meager resources, whether it's in Asia, Pacific Islands, Africa, other areas. So I think as the vaccine supply expands, donor organizations can help out there, just like they do with many other vaccines. There are some countries in Africa that get all of the childhood vaccines, and these are countries where the annual healthcare budget per person is $1. Think about that. You know, $1, you can't buy any vaccine for $1. But the donor organizations are able to arrange purchases and distribution. So I think that's going to be the answer. Waiting for drug treatment is expensive and runs the risk of severe disease before you can get your hands on the drug.
Right. So better act fast and act early. Okay. All right. Someone has asked, does having symptoms after vaccination lead to better immunization? Ella, what do you think?
So I spoke to someone in my department who actually tested that, and he said he didn't see any connection between the adverse effects after the vaccine and the level of antibodies. So it doesn't mean anything.
Right.
Probably,
okay.
Most likely. I don't know how large was his cohort, but I mean, I don't think you can draw a conclusion from the amount of pain you had in your arm to the amount of antibody.
Right. Okay, I'm scrolling through. We had so many messages and questions here, so I'm scrolling through them. I don't know. Let's see. What changes can a fully vaccinated person make in their private social life? Are they free to be with other fully vaccinated people? The CDC says these people do not need to quarantine after being exposed to the virus. Why is that? Ron, please.
I'd say right now, as long as there's still a lot of virus circulating, my recommendation, what I've done myself, is socialize with people, but keep on masks, social distance, keep up hygiene. As the level of virus diminishes, as more and more people are vaccinated and the numbers go down even further, we'll find that masks and social distancing will no longer be necessary. And again, it's very hard to predict now. We shouldn't try to pinpoint the timing, but that will happen in due course, hopefully within the next year. But in the meantime, yeah, you can continue to do those things. Israel is opening up its economy now to for health facilities, restaurants will open, the theater will open. Again, for people who've already been vaccinated who can show a vaccination certificate. So things will open up and more as time progresses. And hopefully a year from now, we'll be much better off than we are today. I'm very confident we will be.
Okay, all right. Right, we're going to have to bring this to a close. Ron and Ella, any last things that you would like to say to our audience? I mean, you've been quite optimistic, but you're also, you know, telling people to be vigilant. But any last thoughts, Ella?
So I think Ron kept on saying it again and again. I mean, you know, follow the guidelines, social distancing, masks, get vaccinated, and then that's our key to getting back to normal life. And if we all do that, if we all do that as soon as possible, I think we'll see the end of this.
Right. Okay, Ron, I'm guessing you're going to say something similar too.
Yeah, similar, and it's not just a question of protecting yourself; it's a question of protecting others. As I say, the virus, the vaccine does not prevent infection. And you can be perfectly healthy, but have virus replicating in your nose and mouth, and you breathe it out and you can infect somebody else who is more vulnerable than you. So I think we owe it to all of society and to our fellow man to protect each other. We're not just protecting ourselves, and we're all in it together, and we'll get out of it together. but we have to follow those guidelines.
Okay, great. Well, look, this has been a really fascinating discussion, and I hope it's helped shed light for all of our viewers too on a very complicated and timely subject. So I'd like to remind you all that you can send in questions to us, and we'll pass them to Ron and Ella, and then we'll post the answers on our site. Ron and Ella, thank you so much for joining us tonight. I know that you're both extremely busy, so we really appreciate that you were able to share your time with us. And thank you to all our viewers too. And if you want to keep abreast of the vaccine developments in Israel, do visit our site. We're running many articles on this subject and cover all the latest innovation and cultural developments coming out of Israel as well. So thank you everyone, and stay safe wherever you are and wear your mask. Thank you.